What happens to a lung cancer tissue sample after biopsy? When a doctor takes a tissue sample from the lung to check for cancer, it goes through a detailed process to help diagnose and plan treatment. First, the sample is collected using different methods. It could be a needle biopsy, where a thin needle is inserted through the skin, or during a bronchoscopy, which uses a tube to look inside the airways. Sometimes, a small piece of lung tissue is removed during surgery, like video-assisted thoracic surgery. Right after removal, the tissue is placed in a preservative solution called formalin. This keeps the tissue from breaking down and preserves its structure for analysis. Next, the preserved tissue is sent to a pathology lab. There, technicians prepare it for microscopic examination. They put the tissue into small containers called cassettes and then process it overnight by embedding it in paraffin wax. This creates a solid block that protects the tissue. Thin slices are cut from this block using a device called a microtome. These slices are so thin they can be placed on glass slides for viewing under a microscope. Sometimes, especially during surgery, the tissue is frozen quickly and sliced for immediate examination. But this method provides less detail than the wax-embedded sections. Once the tissue slices are on slides, they are stained with special dyes that highlight different parts of the cells. This staining makes it easier for the pathologist to see cellular details. The slides are first examined by a cytotechnologist or histotechnologist who looks for abnormal cells and marks areas of interest. Then, a trained pathologist reviews the slides carefully to confirm whether cancer is present. They determine the type and subtype of lung cancer, such as small cell or non-small cell, and assess other features like tumor grade and whether the margins are clear. If cancer is confirmed, additional tests are often done on the tissue to look for specific genetic mutations or biomarkers. These molecular tests help identify if targeted therapies might be effective for the patient. The results from all these analyses are compiled into a detailed pathology report. This report states whether cancer is present, describes its type and characteristics, and includes information about any other lung tissue changes like inflammation or scarring. The healthcare team then uses this report to decide the stage of the lung cancer, plan the best treatment options, and predict outcomes. The doctor will discuss the findings with the patient and outline the next steps, which could include surgery, chemotherapy, radiation, or targeted therapies. In summary, after a lung cancer biopsy, the tissue sample is carefully preserved, processed, sliced, stained, and examined by experts. This thorough analysis confirms if cancer is there, identifies its type, and provides vital information to guide personalized treatment and support lung health. Always remember to consult your healthcare professional for personalized advice and treatment options.